And now on to our next story. For most people, magic mushrooms are a dangerous, scary, illegal drug. If asked to describe the effects, many would likely say hallucinations or describe a bad trip. However, scientists at several respected universities, including Johns Hopkins and NYU, are challenging this conventional thinking. What have they found out, John?
These researchers have uncovered several new uses of psilocybin, specifically as new treatments for different psychological disorders. We're going now to our resident scientist, Dr. Johnson.
Thanks, guys. As has been said, this research that has been coming out has the potential to really change the way people think of psilocybin-containing mushrooms. In a recent study, psilocybin was tested as a potential cure for treatment-resistant depression, or, in other words, for those with depression who have sought out several other treatments with no change in symptoms.
That's interesting. So you're saying that this mushroom can be used to treat depression?
It very well might. In the study, scientists gave participants 2 rounds of psilocybin and then followed up after a week and again after 6 months. After a week, all 20 of the participants experienced a significant difference in the symptoms of their depression. The effect remained significant 6 months after these 2 initial doses. One of the biggest advantages of this kind of treatment over traditional antidepressant is that none of the participants felt an emotion-numbing effect, which is very common for popular antidepressants.
Wow, that sounds like a pretty big deal. Thanks very much, Dr. Johnson. Are there any other uses for psilocybin?
That's actually where this gets really interesting. In other studies done by researchers at different institutions, psilocybin has been found to be an effective treatment for drug and alcohol dependence and nicotine addiction, all of which are notoriously difficult to treat effectively, as well as a treatment for death anxiety in terminally ill cancer patients. Interesting, and much different from all other psychological disorders discussed so far, psilocybin has also shown promise as a treatment for cluster headaches, which are often called suicide headaches. As the pain can be so severe, sufferers sometimes resort to suicide to stop the pain.
That's amazing. Who would have thought that this illegal drug could have so many benefits? Speaking of illegality, psilocybin is a Schedule I drug in the United States, which means legally, it has no recognized medical benefits. With all of this research, could this change anytime soon, John?
It's looking as if it might, John. In states such as Oregon and Colorado, there are preliminary talks about the legalization of medicinal psilocybin mushrooms. A big factor in these talks is the fact that the drug was recently approved by the FDA as an experimental treatment for treatment-resistant depression, a landmark decision for the legality of the substance.
Now, with the understanding that psilocybin has these possible benefits, how do some of these actions work in the brain?
Well, the mechanisms that this drug works on are extremely complex and vary for each of the possible benefits. Some of the ways the drug works are yet to be discovered by scientists. Just for depression and anxiety, in the simplest of terms, when someone takes psilocybin, it is converted in the body as psilocin. Psilocin is very similar to serotonin, and because of this similarity, it has the ability to bind to receptors in the brain meant for serotonin called 5-HT2A. The binding is said to be responsible for its hallucinogenic effects, as well as for some of the benefits mentioned. More research is currently being done, and in coming years, scientists may find even more benefits of psilocybin.
Thank you for that stellar report, Dr. Johnson.
You know, now that he's gone, he looks an awful lot like you, John.
John, I don't know what you're talking about. That's the end of our program for tonight. Thank you for joining us. I'm John.
And I'm John. Good night.